Infertility is a disease of the reproductive system. It makes a person unable to have children. It can affect a man, a woman, or both. Male infertility means that a man has a problem with his reproductive system. It means the man cannot start a pregnancy with his female partner. It can be challenging to discuss sexual health problems, but it's important to speak to a doctor about conditions such as erectile dysfunction, low testosterone, or infertility. An underlying medical condition may be the cause. Sexual health conditions such as erectile dysfunction, abnormal curvature of the penis, and infertility can do more than just affect your sex life. They can harm your relationships and self-esteem. On your regular health television talk show, The Physicians, we'll be discussing male sexual health, risk factors, and supportive management. It's another day with The Physicians, where your health is our business. Today we'll be discussing male sexual health and fertility, risk factors, and supportive management. My name is Dr. Martina Agberie, your regular anchor on this program. And I'm not alone. I'm with my very elegant, delectable co-host, Dr.
Emuna Yusuf Kadri. It's always a pleasure to be on set, and of course from our lovely viewers, how are you doing? Because you know what? Your health is
always our business. Dr. Mimuna, we're discussing male sexual health today. And we've always talked about the female sexual health, reproductive system, and all the stuff. But now we've decided to deep dive into the male sexual health itself. And that is because so many people are beginning to ask questions. And I had somebody, a lady who had a challenge. It was actually an infertility case. And her husband was like, please, do you want to help counsel my husband to come with me to the hospital? Because the man just refused to go with her, as if it's only a woman's problem. And the woman said she's been pleading, she has gone, she has done a lot of investigation tests, and he said nothing. But has asked the husband to come, but the husband said he's not going. So if you are in such a position, if you have to counsel, what do you do to such a man?
You can't beat him, you can't force him, you can't, pressure him. You can only make him see reasons why he has to be there. We all understand that infertility has both female and male factor. And sometimes it's not the female, sometimes it's the male, up until the males come around with their partners for proper screening. Then you can, and the thing is that
there's even this. I think there was a study, and it's actually a paper documented that at least 50% is an equal thing.
Yes, it's not a female thing. But of course, talking about it, which is one thing we are doing here in the Physicians, let the men understand that this is not a God forbid kind of thing. It's not a spiritual attack. Yeah. It's not making you a man of weak character. Yeah. You are not a bad person.
The truth is, in the course of this program, we have a prof that is going to come and talk more about it, the risk factors, so that if they know that the possibility, that the reasons why, then you'll be able to understand, okay, I think I should really go for
fully well that this is what I have and it's treatable and treatment is available. Was a big deal. But if you don't even avail yourself for them to know the reason, the root cause, how do you want to treat it?
How do you really want to treat it? So we'll be back after the short break. Stay tuned. Welcome back. If you have just joined us here on your regular health TV talk show, The Physicians, where your health is our business. And of course, it will always be our business. Today we'll be discussing male sexual health and fertility, risk factors, and supportive management. In the studio with me, we have Professor Akinloye Bamigboye. He is a consultant obstetrician and gynecologist. He is the MD, CEO of LOUISMED Specialist Hospital in Victoria Island, Lagos. You're welcome to our program, sir.
Thank you very much. Nice.
Welcome, Prof.
And congratulations.
Oh, well.
Congratulations
Wedding?
on the wedding, yes.
My daughter got married.
Congratulations.
Congratulations. I wish them the best.
Yes,
Thank God you are a gynecologist and you're a professor.
Yeah, I give her some advice.
You give her some,
to do.
that's really nice.
Yeah.
Is she a medical doctor too, like you?
No, she's a lawyer.
She's a lawyer.
Yeah.
Okay. Because I know you have one, the young doctor coming up.
The sister is a medical doctor.
Okay.
Actually, many of my patients in Nigeria here
Yeah.
actually ask for help.
Okay, all the time.
Because she has come to assist me. Also,
Okay. That's nice. You're doing very well. You've done very well too.
Thank you very
And you
much,
still look very young.
Oh, well,
Okay, so let's get to the business of the male sexual health and the risk factors and supportive management. Talking about male infertility, okay, male sexual health. Maybe we should first of all define what infertility is. If we define what infertility is, then we can take the discussion from there.
Yes, infertility is defined as the period in a woman or in a couple, actually, where the male and the female partners are not able to procreate. You know, it has to be in a span of 12 months,
Okay.
and they must have regular sexual intercourse.
When you say regular, you want to define the word regular?
Well,
How many times a week?
For my viewers at home,
Yeah.
regular means as per what they want to do.
Okay.
So if they want to do 5 times a week,
Okay.
they are doing it. If it's
Okay.
once a week, they are doing it.
Okay.
But medically, for the purpose of research, we advise maybe 3 times.
3-4 times a week.
should be
Okay. Okay.
Yeah.
So 3-4 times regular sexual
sexual
intercourse. Okay.
yeah.
And you leave
And you must not use a barrier,
A barrier
or
contraceptive
any form of
method.
contraception in the process.
Okay.
Yeah.
That's interesting because that is regular, unprotected, 3 to 4 times a week for a period of at least
1 year.
1 year.
Yes.
Because
It's really there.
we've had couples come. You know, some people just before marriage, they really just plan what they want to do, how they want to go about it, and they tell you by December, 9 months from now, I must have my baby. Okay, yes, and they really don't put some things into consideration. Okay, so 3 months down the line, 4 months down the line, they're saying I'm infertile, I'm unable to get pregnant. It's a case of infertility. But doctors will tell them you are not yet married for 1 year, so it is not actually a case of infertility. Okay, so for those people out there, I think it's more of allaying the anxiety, right?
Yes, it is an anxiety issue
Okay.
because I see these people in my office every day, whereby, Professor, we are getting married next month, and please we want to do infertility testing. I say, what? You are just wasting some time. I tell them, it's easier for me to say, okay, I will do some blood test on you, pay this amount of money, I take it, put it in my pocket. But I tell them, no, I don't do that. You must be married, you must have regular intercourse for nothing less than 12 months. After 12 months, come back, then we can see you. Yes.
Okay.
That's right.
Okay. So now that you talked about the period of at least 1 year
Yeah.
of regular sexual intercourse within a space of time, then we can now discuss the risk factors or the possible causes of infertility.
The risk factors, unfortunately,
For the male, remember
for
we're
the
dealing with
yes,
the male.
For the males, the world over is increasing over the decades. When I was in school, it used to be more of females causing infertility because of 2 factors than men causing infertility. A ratio of 1 to 4, okay? But as time goes on, like in the early 1990s, there were studies that came up saying that, this is increasing, and we have figures of, say, 50% male and 50% female. So it's like coming up, and it gets on. It keeps on worse. I mean, getting worse, I should say, in the sense that in female these days, at times in some population we have females even less than male. Males are doing 52% in some studies, whereas females are doing 48%. Okay. Okay, so this thing is getting worse. So the risk factors actually are going to be found more in male these days. Things like temperature.
Okay.
The air temperature is so important. Like, look, the scrotum is placed outside of the body.
Okay.
There's a reason for that. The biologist prefers that for the scrotum or the testes to have fresh air blowing into the perineum.
Okay.
So if you pack your perineum with panties and so on, it will be hot.
Okay.
And when it is hot, then there will be problems of infertility because the sperms cannot grow in the condition of heat.
Okay.
Yeah, that is one.
Okay.
And then we even have things like even sand waves. If you are in a situation whereby you taking too much sand every day, that is going to affect your.
What do you mean taking too much sand?
It means your pollution, in terms of
sand, like, okay,
is too high.
Okay.
Then you're going to be losing sperm. We have done studies to do this. We've done course studies. We have done case control studies to measure the amount of sand versus the sperm counts. In males, we have that happening. A condition called oligospermia, and even Frank has spermia sand waves.
Wow.
The other things are microwaves. The things like electromagnetic waves. Okay. We get all those ones from our cell phone. People put their cell phone in their ear and they put it in their pocket, less with the groin. Those waves are transmitted to the testes. And that again can cause low sperm count.
Cell phones in pockets?
Yes, they can do that. So where do we want us to keep cell phones? I don't know.
Look at the back pockets?
No, they are pouches that you can hold phone on.
See, if you take
or like a bag, like a purse, like
that is very good.
Briefcase.
But you see, people don't use pouch any longer.
Or the breast pocket and your shirt or your.
I should think so because at times when I put myself on my breast,
your heart.
I think on my heart. Yeah.
Yes.
I said no, I won't put it back to the groin.
So which one is more important?
For me, at the age, I'm a grandpa now, so I'll also become a grandpa. So I'm okay with.
Yeah, but for those that are younger,
the younger ones in their 30s, they may want to have more kids, and I would advise for them to carry a pouch around.
A pouch. Yeah. Laptops on their laps, that's also an issue.
That is yes, very, very good. That is, it's called laptop, and you put the laptop on your lap, and the lap is close to the groin, and there's heat transmitted there. Then there's also and there are also waves, sound waves.
Okay.
Prof, you made mention of the fact that in some of your researches you are finding 52% in males, sometimes 48%
females.
And then in recent times it's as if the males are even taking over. What could be the reasons for this? Though you are talking about the risk factors, are there other reasons why we are now seeing? Is it that it has always been there but we're not noticing it, or is there are some underlying factors that are now unearthing this increase in male factor than the female factor? Because those days it was just like it's a female thing. In fact, it has broken a lot of homes. If there's a couple is married a year and they don't have any kids, everybody just assume it's a woman. Meanwhile, we don't know whether it's a man. So are there some pointers to why are we seeing an increase in the rate of male fertility? Is it more awareness? Is it more advocacy? Are there other things?
Thank you, Doctor. There are two caveats into this.
Okay.
The first caveat is the quality of research in the past. The quality of research before, says 40, 50 years ago, was dicey somehow.
Okay.
Because examples of which I cannot tell you here now. But that quality improved
over time.
After a while, yes. And we can then do studies that are really addressing the methodology of these studies, then ensured that the ideal figures are got. That was why we got this implement. That's one. Two, the issue of the environment.
Okay.
So things keep on increasing daily. The temperature of the world keeps increasing.
Climate change issue.
Climate changes issue be one. Then the other things that I've just mentioned. People carry cell phone, which was only 20 years ago.
Yeah, right.
So all those things have changed the environment to affect the sperm count. So yeah.
we'll come back from break. You will need to discuss more on the causes because we already talked about the risk factors. So we'll come back from break. We'll talk more on the causes. So for our viewers out there, let us hear what you have to say about male fertility. What is your own opinion, your views? We need to hear from you. Let's hear from you in keeping up with the physicians. We'll be back after this short break. Don't go away.
I guess there has to be awareness now because it's usually more focused with the women most of the time. So I guess it's a good thing that there's probably an awareness a little bit with male sexuality and health.
Male sexual health is talking about everything as regards sexual, everything that has to do with being sexual in men, their sex drive, their hormones, everything that has to do with sexuality for guys or men.
The sexual aspect, I think, is a good thing for the man to always have sex with his spouse, so they don't get this thing called what's it called again? I forgot.
Welcome back. If you have just joined us, you're on to your regular Health TV talk show. The Physicians, where your health is our business. We've been discussing male sexual health, the risk factors, and of course, supportive management. So now let's talk more about the causes of infertility in males. We've talked about the risk factors. Now the possible causes.
Okay. The producer, I'm happy that you are bringing this up. Infertility in male could be caused by obstructive factors and non-obstructive factors. When we talk of obstructive factors, it means the passage of the sperm or the semen from the testes to the whatever is going to the penis and so on and so forth is obstructed. Either iatrogenically, it means by the doctors doing operations in the past, the one they call aneurysm, the one they call orchidopexy. Okay, those are the things that can mistakenly, inadvertently block the pathway of the semen. So that's it's an obstructive cause. So, and that one could be corrected if you realize what it is early. Then the non-obstructive causes, there are things like metabolic causes, things like diabetes, thyroidicosis, then even hypothyroidicosis, you know, or the sugar is too low or too high. All those things can cause
sperm disorder.
Same things that will make the sperm not to be good enough. There are things like genetic anomaly, whereby there's deletion or translocation of the genes. There is a particular section of the genes which regulates the sperm issues. So when those genes are not adequate, standard, they would cause azoospermia or low sperm counts.
So that is sperm disorder.
The sperm, those are the things like too much lucidity of the sperm. Okay, it's found in cystic fibrosis, for example. Those are the things that can really cause infertility. That no causes that. Yeah.
So, Prof, now we've talked about risk factors and some of the causes which are that obstructive or non-obstructive. How will a man, so that our viewers are sitting and watching us now and listening to us, and a man, we are speaking to a particular man in this audience, and it's like, I don't know, how will I now know if I have a fertility issue? I want you to speak to that one man. How do we get to know? How can they know that
possible that
this is
or something?
Yes, or I have infertility? Because it's not something that you can just like click, or there's something that can show that this is a diagnosis that for them to know that they have infertility. Okay,
the most crucial test that you do to ascertain whether a man has got infertility or not is sperm test. Sperm test.
As simple as that.
Yeah, it's so simple. It's the sine qua non of infertility in male. If you do not do anything, do the sperm test in men. If you do a sperm test, you will be able to say whether there is no sperm produced at all or the sperm is defective. If the sperm is it not able to move, has it got 2 heads or 3 tails? They have all those things. Abnormalities in the sperm. We pick them up. So if a man is refusing to do tests, he must at least do a sperm test. After that, you can then say, okay, you are fine or you are not fine.
So how do we manage management
in all this?
Because supportive care, yes, how do we go about that?
Yes.
Now you have done your diagnosis, you have no, so how do you manage?
What we do is basically to boost the sperm, so-called boost. People talk about boosting the sperms. There are many medications there in town that are used to boost sperms. Many of them do not work, but some really research has shown that it has worked. But what we do is to ensure regular or adequate vitamins, in those people by giving them supplements, vitamins, and those can improve the sperm. Then there are other things that we do to treat or to cure azoospermia or oligospermia. That is trying to give or to run away from those risk factors that I've talked about. Run away from sauna bath, run away from putting your cell phone in the wrong place, run away from putting your laptop. Do not smoke. Yes, you are very correct. Do not smoke. Do not take alcohol. Okay? Then, interestingly, do not or run away from big fat, obesity. Your BMI must be normal. So if you are looking for a child and your BMI is 35, then it means you are not doing yourself a favor. Run away from such things. Then ensure you check your sugar level. Make sure that it's not hyper or hypo. No, those are the little things that we can do to treat. So I haven't done that. Then you look for the specific causes if you can find them. If it's due to obstructive issues, you can do operations to correct the passage. That could be done. And if it's worse, you can even go and harvest a sperm, wherever it is stored, and take them out for a process of artificial
insemination.
Yes. So those can be done.
Wow. Thank you very much. But before we go, there was one I saw yesterday. It's a gift. Gametes intrafallopian transfer. Wow, we're going places. On that note, I just want to say thank you for coming on our program, Prof. I'm sure our viewers out there must have been enlightened.
And they must also note that there's something also called ICSI. ICSI is even more common than gift.
What is that?
ICSI is intracytoplasmic sperm injection. It means people who have got oligospermia.
Okay, that's true. ICSI, intracytoplasmic sperm injection. Yes, right.
They will pick up the best sperm which they can see and
use
inject it into the egg.
Instead of doing blindly.
And that we do it in some clinics. On every IVF, we do that.
Oh, wow. Thank you so much, Prof, for coming on our program again. We've actually enlightened us even on the new techniques that is available. We really appreciate you. I'm sure when we call again, you honor our invitation. And to our viewers out there, I'm sure you have been enlightened. If nothing else, just remember, your cell phones, do not put them in your pockets. Do not put your cell phones in your pocket because of the waves. Because we know very well for guys, for males, the sperm, the scrotum is outside. It's for a reason. Because the temperature outside is better than that of the inside. That is why it's not inside. So always ensure that your phones are not in your pocket. Therefore, if you travel, if you are sitting for a long time, even if it's in the office, don't stay for too long. You can stand up, move around, and come back and sit down. If you're also traveling, take some time and stop. Do some stopovers, move around them before you continue your journey. If you only want to protect yourself and ensure that you have healthy sperm when you really need them. So I want to say thank you so much for keeping the day with us again on your program, The Physicians. My name is Dr. Martina Agbere. Till next week, stay blessed.
Thank you very much, Prof. And of course, to all our viewers, if you heard it, if you're a man out there, or you're a mother, a sister, a daughter to a man out there, please encourage them. No drinking, no smoking, no don't be overweight. All these can affect your sexual health, especially your fertility. Please be kind to follow us on all our various social media platforms, Twitter, Instagram, Facebook, and of course, if you want to be like Prof right here in the studio, you are just a click away. Go to our website and fill the form, and you'll be our next guest. If for any reason you've missed any of our programs, please binge on our previous episodes in our YouTube channel, The Physicians NG, and you'll be glad you did that because it's very empowering, and of course you can share the news with loved ones all around you. My name remains Dr. Mimuna Yusuf Kadri. Until next time, remain blessed.